To go ahead and get started today. Teresa and I are just going to leave our camera on shortly during the introductions. It's something we've changed up a little bit, but thank you so much for your time and attendance today. My name is Becky Page, and I'm President of Human Resources Plus, along with Teresa Friel, who's HRP's senior HR professional that many of you probably have spoken to her. In addition, we're pleased to have, again, Jennifer Gokenbach as a co-presenter. Her top-rated firm, the Workplace Council, has represented a number of employers and companies throughout many industries, and she's really been a valuable strategic partner for us. And thank you so much again, Jennifer, for helping us out. For those of you who aren't familiar with HRP, we're just very passionate about providing quality and affordable HR services and guidance, along with education. That's really important to us. We kind of excel at taking this complicated law, kind of drilling it down into and communicating it in a way that you can implement it into your business. So if you have any colleagues that you think would benefit from our webinars, you will be receiving a copy in an email. Please feel free to forward it to them. There we go, my thing was stuck. Also, just keep in mind, we have a lot of different attendees from varied backgrounds when it comes to the number of employees, industries, and as we all know, COVID has a lot of different rules for the different industries. And we're going to try to touch on the topics that are pertinent to as many as we can on the webinar. So I'm going to go ahead and turn my video off, and we are going to start with just a few things. Okay, so we'll start with the housekeeping. You know, you have been muted to ensure everyone can hear. Make sure your video is turned off. As I mentioned, you will receive an email copy of the PowerPoint presentation and recording. We value your time, and we are going to have a hard stop in an hour. We always have to have the disclaimer. As you know, everything changes pretty quickly. So all this information is what we know as of today. Also, this is not intended to be or provide legal advice. So we do encourage you, if you have specific questions, that you speak to legal counsel of a competent attorney. And if I can get to the next slide. It doesn't seem to be wanting to move for me. There we go. So our agenda is, we're going to talk about the OSHA ETS vaccination or testing mandate. There's a few updates in that just came out actually yesterday, the 26th. Also, we're going to discuss something that a lot of people may have not heard about, but it's called payment of earned vacation upon separation of employment. And then we're going to dive into the Colorado paid sick leave law and the public health emergency pay. This is where most of the questions are definitely generated from. So I'm going to turn it over to Jennifer and have her kind of give us the overview of the OSHA mandate.
Okay, thank you, Becky. For those of you who aren't aware of the OSHA emergency temporary standard that was in place, that was announced by OSHA in November of last year, November 5th. And what that emergency temporary standard was put in place to do was to require all private employers who had 100 or more employees to either require employees to have been vaccinated from COVID-19 or to undergo weekly testing. And so it was known as the shot or test mandate from OSHA. Not surprisingly, the day after it was published and made public, lawsuits were filed all across the country in nearly every circuit appellate court. And those were all consolidated. So those lawsuits were filed across the country from November 6th to December 17th, and those were consolidated into a multi-district appellate action that was drawn by lottery as to which appellate court would get it, and it got assigned to the Sixth Circuit. After those were consolidated, the Sixth Circuit entered an order enjoining or putting a stop to the emergency temporary standard by OSHA. And then an appeal was made to that decision by the Sixth Circuit, and it went up to the US Supreme Court. Then just this month, the US Supreme Court heard oral arguments on the case, and then on January 13th entered an order blocking effectively the implementation of the emergency temporary standard. So the US Supreme Court agreed with the Sixth Circuit in a way and said, I think this is beyond OSHA's authority to be able to, or I should say, we think it's beyond, there's not just one judge, but we think it's beyond the authority of OSHA to regulate something that deals with public health matters like a vaccine, as opposed to just regulating what happens in a workplace from a physicality perspective of the workplace, the space, the dangers associated in the space. So after the US Supreme Court entered its opinion on January 13th, then just yesterday, on January 26th, OSHA decided to permanently withdraw the emergency temporary standard. So what that means is, you know, we all have been kind of sighing a bit of relief over, you know, all of the regulations that have been coming into place since COVID started. But then this is a big sigh of relief knowing that for now, the emergency temporary standard is has been pulled, is not in effect at all. The caveat there, though, is that it was an emergency temporary standard. So what we understand from the US Department of Labor and the OSHA division of that is that they are going to seek to make a permanent rule, which is just a different process, and it takes longer. So I think there's still an intent and an interest on the part of the government to have a mandatory shot or test rule for the workplace, but they're going to have to go through the permanent rule process, which is a lot longer to get into place. So this is one of those where it's stay tuned, but for now, the ETS that would have applied to employers with 100 or more employees, that is in our history, in our rearview mirror, and we have to wait and see now what OSHA is going to do with respect to a new permanent standard.
And I don't know if you can speak, Jennifer, on, I do know that there's two other mandates. You know, this one applied to private employers. There's the CMS and then the federal contractors. I don't know if you can, you know, address kind of where they stand right now or.
Sure. So there was other litigation and another rule that was put in place by the Centers for Medicare and Medicaid Control. I'm trying to figure out what the acronym stands for, but CMS is basically the government agency that regulates healthcare workers. And so CMS implemented a rule that all healthcare workers needed to have vaccinations for COVID-19, and that rule was upheld. So that is still in place with respect to any healthcare workers. So that includes people that are working in hospitals, working in urgent care facilities, working in any sort of healthcare facility or capacity, even, you know, senior living facilities, et cetera. And those are healthcare workers also that, you know, accept Medicare and Medicaid funding. So that's where CMS comes into play. And then the other question you had was about the federal contractors. Mm-hmm.
Yeah.
And that was an executive order that was entered by President Biden And the federal contractor requirements, as far as I know, and I could be wrong this morning, but as far as I know, those are still in place. So federal contractors who have contracts with the federal government, they are required to be vaccinated per that federal contractor rule.
Great. All right, so like she said, that's kind of a stay tuned. All right, now we're going to move on to the Colorado Department of Labor and Employment. January 1st of this year, they issued what was called an interpretive notice and a formal opinion. And I'm not sure, Jennifer, if you want to give like just a 2 to 3 minute update on kind of why the CDL kind of came out with this.
Sure. So the new guidance from the Colorado Department of Labor on vacation time follows two court cases that were decided by Colorado appellate courts that dealt with whether or not vacation pay upon separation of employment has to be paid out. And those cases were decided last year, and then the Colorado Department of Labor, put in their new guidance, which basically provides employers with the department's opinion on when and how vacation pay should be paid out. So those were cases that were litigated. Vacation pay has always been something in Colorado that hasn't been clear. For a while, it was, yep, you can have use it or lose it policies. And then for a while it was, no, you can't. And then it was just kind of this back and forth. And so it was kind of in a state of confusion. And so that's what these cases addressed. And then in response to those cases, the Department of Labor just implemented this new policy guidance that sheds light on their opinion.
Great, thanks. And just to let everybody know, we have links throughout the PowerPoint presentation. So when you get them, you can definitely open these up and read through them. So not only has there been this confusion of use it or lose it, there's been confusion between terminology of vacation versus PTO, which this is kind of set out to clarify that. So we just start off with the first thing, that employers' policies and agreements can set whether, how much, and how to offer vacation pay, and companies still at this point, private companies, are not required to provide it, okay? Now, under the Colorado Wage Act, this interpretive notice says no policy or agreement can say that an employee's performance, termination, resignation, or other events can forfeit or waive already earned vacation pay. You will see on the next page, which I took right from the interpretive notice. Now, most people, I do know that if they have a PTO policy currently, they pay out usually at the end of employment. However, I do know there are some employers that maybe have, if you don't give a 2-week notice, or if you were terminated, involuntarily terminated, that you don't receive this pay. That is no longer, if you have that in your employee handbook, you must remove that. Also, this is where it goes on to kind of define the definition. So some paid leave meets vacation pay definition, but has a different name like personal days, paid time off, annual leave, etc. So labor rights depend on how employment works in reality, just not how it's labeled. And actually, that's kind of a good thing to think of throughout your entire, when you think about employment law in general. So if paid leave by any name meets the vacation definition, then it counts as vacation pay, which is required to be paid out when an employee separates from their job. Now, another thing that's kind of been confusing through the years, and I'll read the last paragraph in this interpretive notice. It says, unlike for some other pay types, the Colorado Wage Act does not require vacation to be vested in any way other than being earned for it to be payable at separation. Once vacation pay is earned, no extra vesting conditions can be added, and all unused vacation must be paid when employees separate from their jobs. So I just want to clarify, Jennifer, to make sure that I'm clear on this, that, I know that, at one point employers would say, okay, you can start accruing it your first day, but you haven't earned it until 90 days. And I think that paragraph, does that negate that now, Jennifer?
I think it does. I
Yeah.
mean, obviously there's still going to be nuances with terminology used, as always in legal matters, but I think what the Department of Labor is trying to do is create a hard and fast rule so that there's not a lot of that ambiguity in what words do you use. For example, it used to be that you could say, well, you didn't accrue, you wouldn't use words like accrue or earn. You would use words like this is a benefit of employment, or it is, vacation is being granted. You might use, different words to avoid it becoming an accrued wage. And this again is prior to the court decision from last year and prior to this info being published by the Department of Labor. So I think what they're trying to do is just have it be more black and white, at least from the agency's perspective, as to how they're going to view vacation.
One last thing I'm going to read is they do define, so vacation pay is any paid leave that's usable for any purpose the employee chooses at their discretion. So this is unlike paid leave, if you think about it, for like bereavement or holidays. So we're going to move on to the next one. These are examples that you can click on the link. They do give other examples. The first example is the one we talked about, that if somebody gives a 2-week notice, they don't receive their vacation pay. That currently violates the Colorado Wage Act. Another one that we see is that companies may have policy. This one is the example is that you accrue 15 days. December 31st comes, they haven't used their 15 days, and the employer says you can only carry 12 days forward. That is no longer permissible. Okay. Only if the employer by December, let's say it's January 1, December 31st, brings the employees down to 12 days by 12/31, or by requiring time off or paying some of the vacation days. So as I mentioned, there's a link there if you want to read more about it. There's some pretty good examples on the actual link. So now we're going to get into the meat of the webinar, and Teresa's our expert on this, and I'm going to let her go ahead and take over.
I don't know that I'm an expert, but I've been dealing with it a lot. So getting a lot of questions, obviously, because starting in January, we went from employers with 16 or more employees were required to provide the HFWA paid sick leave. Now all employers, regardless of size, I think there are a few exceptions in there, but are now required to provide. I think we got somebody who need to mute. Are required to pay the HFW paid sick leave, and that's up to 48 hours. We've also been getting a lot of questions about public health emergency. So Catherine has put together this really great little chart here for us. So you'll notice in the first column is the FFCRA. If anybody can remember that, that seems so long ago. FFCRA was actually in place starting April 1st of 2020, and that did expire on December 31st of 2020. They did extend that as a voluntary option for employers, not a requirement like it was back in 2020. Can we mute there? Becky, can you mute?
Yep, I'm working on it.
Okay.
This is normal.
So anyway, they extended that as a voluntary option. However, in the meantime, Colorado declared a public health emergency, and that was effective 1/1 of 2021. So I kind of skipped a column. So we're going to go right into the public health emergency. And what that is it's up to 80 hours. If you have full-time employees, then it's the 80 hours. Otherwise, they do provide information on how to determine how many hours an employee would get if they're not full-time. So that was effective 1/1/21 for employers of all sizes. It has been extended. I think on a federal level, the public health emergency has been extended 8 times. And we've seen that for Colorado's as well. So the date as of today is May 14th, 2022, that the public health emergency will be in place. Typically, we know, we'll know probably mid-April if they're going to extend that even further. No tax credits available for the public health emergency supplemental leave. We also have the paid sick leave, which is permanent. It's not going to go away. There's no expiration date on that. And that is up to 48 hours of paid sick leave. Again, that was effective 1/1 of 2021 for employers with 16 or more employees. And then recently on January 1st for employers with 15 or less. Again, no expiration date and no eligible tax credits for that paid sick leave. Let's see, let me see if I have anything else to add on there. So with the paid sick leave, just so you know, we're not going to get into great detail on that. So I just want to mention that it is a carryover. So any unused paid sick leave, the up to 48 hours does need to be carried over from year to year. You do not have to pay out at time of termination. However, if you do have an employee that is terminated and rehired within 6 months, you do have to reinstate however much time they had when they left of the paid sick leave. However, and Becky just explained the payout for PTO. If you do combine your PTO and your HFWA policies, then you do have to pay out at time of termination. So it can get a little tricky there. And we'll talk a little bit more about the combining the two in a few slides. So employers can have a separate standalone HFWA paid sick leave policy, or you can combine the two. If an employee has unused, accrued PTO, HFWA, when their need for a public health emergency related leave occurs, so that's the COVID reason, an employer can count the accrued HFWA leave toward the amount of PHE related leave it is required to provide. Sorry, that's a little bit of a mouthful there, but we do have a great sample that we'll talk about a little bit on the next slide, just to kind of show you how that works to supplement the two together. Additional HFWA leave does not have to be provided if an employee uses all of their PTO for non-HFWA reasons. So if an employer has, again, the combined PTO HFWA, and you have an employee that uses all that time, regardless of what it is, for personal reasons, for vacation reasons, then they have a need for HFWA paid sick leave. The employer is not required to provide additional time for that. It's a little bit different with a public health emergency, and I know that gets a little confusing, but so if an employer has the combined policy, an employee uses all of the PTO, HFWA, and then the employee is in need of public health emergency, the COVID leave, then you would be required to pay out that above and beyond the PTO, HFWA policy.
Can I jump in?
Again, I know that, yeah.
I just want to jump in real quick. I know that this can be very confusing. It's confusing for us from day to day. And I really encourage everybody to kind of look at it from a pro and a con perspective. So, and that's something that obviously everybody's unique. You know, when we work on employee handbooks, we talk that through with everybody. So, you know, if you combine it, you look at the pro as, okay, I'm not really going to add maybe additional hours to, you know, to have to be added, but you're going to have to pay it out, you know, versus if I have a standalone policy, I'm not going to have to pay it out. So there's all kinds of pros and cons that, you know, like I said, when we work with people on these policies, we just kind of work through individually because there's not one exact policy that works for everybody.
Right. Mm-hmm. Yeah, you just have to decide what works best for your organization. Okay. Next slide, Becky. Here is our, oh, you skipped one. Okay, so here's our sample. So an employer policy that is in place for this specific sample, the employer provides 48 hours of HFWA paid sick leave upfront. So they grant that, or we call it front loaded, January 1st. They have that available rather than the accrual, which is the 1 hour for every 30 hours worked. So Jeremy starts with 48 hours of HFWA paid sick leave. He's full-time and works 8 hours a day and uses 8 hours of his HFWA paid sick leave for a physical injury, which falls under the HFWA reasons. So now Jeremy has a balance of 40 hours of HFWA paid sick leave. And Jeremy gets COVID, which since he's full-time, he would be allowed the 80 hours. He misses 7 days of scheduled work. So you only need to pay for what he misses. So, you know, you don't have to pay 10 days if he only misses 7. So the employer would need to pay Jeremy 56 hours for those 7 days. So what you can do is you can supplement the available HFWA paid sick leave, which is he has 40 hours, and then pay out 16 hours of the PHE supplemental leave for a total of 56 hours. So he's paid out between the two policies. But he would still have 24 hours left of public health emergency supplemental leave since he's full-time and is given 80 hours for that. So hopefully that will help a little bit. Again, we'll send out the webinar, so you'll have that to reflect back to and use as you're dealing with situations. Again, every situation is a little bit different. And then, so one other thing that I'd like to add is documentation. For the public health emergency, employers cannot require any documentation. You can certainly request that the employee let you know whether they're wanting to use paid sick leave or public health emergency, but for the PHE, you cannot require a positive test or any documentation. For the paid sick leave, you can require documentation, but only if the employee misses 4 or more consecutive days. And for your staff that works Monday through Friday, that could be, you know, that they miss a Thursday and a Friday, and then a Monday and a Tuesday. So that would be considered consecutive days missed. So just keep that in mind about the documentation. We're going to share some resource links. One of them is the info sheet 6B, and that goes into pretty good detail on documentation requirements, specifically for the paid sick leave and what you can ask for and what you can't. So it's a good reference to use. So just a little bit more guidance for employers that do want to consolidate your PTO and your HFWA. You do have to comply with all of the HFWA paid sick leave guidelines, which means that it has to be up to 48 hours available. You can certainly do more, especially if you're combining the two. All the same purposes covered by HFWA applicable rules, not a narrower set of policy purposes. So what that means is that if you had a waiting period for your PTO, you can no longer have that waiting period. It needs to either be accrued or front loaded on the first day of employment. And let's see, the carryover has to be included. You can't have a use it or lose it policy in place, and you do have to pay out at time of termination. And again, I want to mention that, if you do have the combined PTO and HFWA policy and an employee takes all of those hours for non-HFWA reasons, then you don't have to provide additional HFWA paid sick leave if that's needed after the fact until the following year when you reset their accrual, or if anything rolls over, which it wouldn't, I guess, if you didn't use it, but if you front loaded or the accrual begins next year. And again, that is, that does not include public health emergency supplemental leave.
Great.
Okay, next slide, Becky. Oops.
All right, let's
one too far. Wait, you went one too far.
Oh, I did.
Yeah.
There we go.
So resources, again, this info sheet 6B is really a great resource. It does get a little confusing because it does talk about, it'll flip back and forth between the Healthy Families Workplaces Act paid sick leave and the public health emergency. And something that I've done is I go in and I highlight. Paid sick leave, I highlight in blue or yellow, and public health emergency, I highlight in blue. So if you ever want a copy of that, just let me know and I can send that to you, but it certainly does help kind of keep track of what the requirements are under each policy. There's also an info sheet 6C, and that just kind of gives you a snapshot of similar to our first slide on what's taken place since 2020. And then I know we talked about the individual liability on our last webinar, but it is important to remember that employees can bring a claim for unpaid HFWA or PHE wages against an organization, as well as individuals in the organization. And that would include individuals that have the power to hire or fire employees, so your managers, individuals that supervise or control an employee's work schedule or condition. So if somebody's calling into that supervisor to let them know whether or not they're sick, it's important that they understand what their obligation is to report to payroll or management. Individuals that determine the rate and method of employee payment, and then individuals that maintain employee records. Again, you can request your employees to let you know what leave they want to take, whether it's PHE or HFWA. For our members, HRP does have a great request form on our website under our COVID toolkits section. That's it.
Okay, we've got a few questions that I want to go ahead and address since we're on this section. So we had a question. So if Jeremy breaks a leg and needs more time off and he's out of HFWA pay and he can't, does that mean he can't use the PHE?
Correct, because that's not a PHE reason.
Great.
So he would either have to, depending on, of course you get into exempt and non-exempt, but it would be unpaid.
And here's another question.
I mean, there are a lot of different options there, so.
Once they use their 80 hours, does that get refreshed when the PHE is extended?
No, nope, it's a one-time starting January of 2021. So if you have employees that used the 80 hours, and if they're full-time, used the 80 hours in 2021, then that does not start fresh in 2022.
How does paid sick work with salary employees?
It's based on 40 hours.
So they accrue at the 40 hours.
I guess that's the question. Yeah. Mm-hmm. So assume that they would get the 80 hours if they're working 40 hours, or if they're, exempt, typically that's 40 hours a week.
Okay, let's see this.
Does that answer it?
I think it did. What if you have a separate tracking for vacation and sick? So you have vacation and sick accrual. Sick time not used is carried over year to year. We cap after 3 weeks. So I'm assuming they're saying sick time that's not used is carried over year to year, and we cap it after 3 weeks. If they leave, are we now required to pay that out? If they leave, are we required to pay it out?
Yeah, so only if it's a separate HFWA policy. You may be tracking it separately, but if you've identified your policy to your employees as a combined policy, then you would need to pay that out. But if you've presented it to your employees as a separate HFWA policy, then you would not have to pay that out.
Okay, what if an employee has a few accrued HFWA hours? Okay, they have a few hours in their bank, and I'm assuming it's a separate bank, gets COVID and uses 80 hours of PHE leave, do they continue accruing HFWA?
Yes, they do. So you can use whatever hours they have accrued. You said a few. So you can use those toward the public health, but they would still continue accruing till they got to whatever your accrual is, if that's 48 hours or if if you provide additional hours.
Ooh, this is a good question, and I don't know if I know this. What about overtime? Does that include for the accrual of the 48 hours of the HFWA?
Yes, it does. It does include overtime hours.
So it's all hours. So they're just going to accrue it faster than someone else.
Yes. So if you notice, the 1 hour for every 30 hours worked, for someone that's working 40 hours, not even including overtime, it's not necessarily meant to be spread out over the year. If you do your tracking, the individual could, accrue that 48 hours, by, October. So they would.
We do get a lot of questions both with our clients, and a couple questions on here is, why is there no tax credits? Only our legislatures can answer that. The Colorado legislatures are the ones that passed this law. So we don't have a very good answer for that one, unfortunately. So.
And it might be because there's funding. We get funding for COVID. I don't know. Jennifer
Who
might be
knows?
able to answer that, but
Yeah.
who knows?
Yeah,
It would be nice.
right.
Yeah, I don't know. I'd have to sit in on the legislative sessions to know the intent and the thoughts that were going through our legislature's minds in passing the legislation and deciding it was not going to provide tax credits. I actually don't know.
I do want to let everybody know that the Colorado legislature, which we follow very closely, started session on January 12th. They are in session 120 days every year. So they started just a little late this year, so it will go to May 11th. Currently, I do not see any active bills. That doesn't mean that there is not bills, because I think there's already been 4,900 of them presented. But one bill, which is to make an exception for the HFWA for employers under 16. The bill would remove that requirement for employers under 16. However, it only has one sponsor, and that doesn't usually fare well. So I don't anticipate that bill going anywhere. We do watch very closely legislatures and make sure we put it in our newsletters if we think something's going to come about. I think a lot of people may have been aware a little bit of the Power Act, which has to do with sexual harassment and discrimination, that started last year. I have not seen that move forward yet, but it was anticipated that'll move forward. So make sure you read our newsletters and breaking news emails. So I think,
Becky, I want to address one more question here.
Okay.
When the sick time carries over the next year, can they use more than 48 hours? So no. So under the HFWA, again, unless you offer more, if an employee accrues 48 hours and doesn't use 48 hours, then that entire 48 hours would carry over to the next year, and you wouldn't be obligated to accrue any additional time for them.
And I do want to address one question about we're going to jump back real quick to the vacation. It's a good question, and they actually give an exact example. They said, can an employer cap hours earned as opposed to bringing down days off at the end of the year? In other words, an employer cannot say you can only carry over 12 days, but can an employer say PTO will stop accruing when you've reached 12 and will continue accruing when the balance falls below 12 days? That's a yes, and that's a specific actual example in the info sheet. So you can say 12 days, they drop below it, they accrue back up to it. That's permissible now under the Colorado Wage Act. So
can you repeat what you said real quick? I'm sorry, Can you repeat what you said about the 48 hours carrying over? Did you say that if they don't use their 48 hours, they don't continue to accrue them?
So if they don't use the 48 hours in the calendar year, then you would carry over that 48 hours, but you wouldn't have to accrue any additional hours for them. So they've already met that minimum requirement of 48 hours for the following year.
What about other hours? So let's say they carried over 30. So then would we only have to accrue until they met 48 again?
That's correct. Mm-hmm. And there are no tax credits. So there's no federal tax credits at this time either. So.
Okay, so we're going to go forward, and we're just going to touch on this very lightly because it's going to make everybody's head spin. And I just want to let you know that this is an area of confusion for a lot of us. But as of last Thursday, the CDC once again updated its quarantine and isolation, and that's the second time within 10 days that they've done it. I'm just going to point out a few things, but I have a link on the end of this webinar that I would bookmark. I would just bookmark it because it's a big change from this 10 days that we've heard. They've defined other things too. A few weeks ago, they were identifying quarantine as vaccinated, unvaccinated, all this stuff. One thing they've identified now as day 0 as the date of exposure. So quarantine is if an employee was exposed, okay? So they're counting day 1 is the first full day after the last contact with a person who has COVID. They're using these 2 words according to quarantine and isolation. They're using up to date, which means a person has received all the recommended COVID vaccinations, including any booster doses when eligible. Now, if you dig in farther into their website of the link I send you, you have to just click on the words up to date, and they explain all the different Pfizer, different types. I'm not going to get into the nuance of that. Fully vaccinated means a person who has received their primary series of vaccinations. Okay. So they're saying if an employee was exposed to COVID and is not up to date, so that's going to include unvaccinated, on COVID vaccines, they stay home and quarantine for 5 full days. So once again, this is going to make a big difference because, unless they get sick on a Monday, it's the days that they missed that they're scheduled for. So if they get sick on a Friday, and that's day 0, day 1, Saturday, Sunday, and they're scheduled Monday through Friday, you only have to play Monday, Tuesday, Wednesday. If an employee was exposed to COVID and are up to date on their COVID vaccines, there's no quarantine, which is really good news. They do not need to stay home unless they develop symptoms. So I know that employees are probably not aware of this. So once again, like I said, I would keep that link. You can read it right off the CDC website. Now, I do want to, have Jennifer jump in and correct me if I'm wrong, but the CDC provides guidance only. Okay, so you just want to ensure that check your local and state government. We try to keep on top of obviously the Colorado state government, but I do know that there's a few counties that have different rules. But the CDC is purely for guidance. Is that not correct, Jennifer?
That is correct. They don't regulate the workplace. They just provide guidance about this public health situation.
Great. Now for isolation, that is when an employee has COVID or has developed symptoms. Again, day 0 is the first day of symptoms or a positive viral test. Day 1 is the first full day after symptoms develop or the test specimen was collected. If they test positive for COVID or have symptoms, regardless of vaccination status, they need to stay home for 5 days and isolate from others in the home. There's the link. Like I said, I really encourage everybody when they get this presentation to get the link and to bookmark it. So we hope that we've kind of touched base on a lot of questions that we receive. I know there's going to continue to be questions, and we do have a little bit of time to answer some more questions. So Teresa, have you seen any more questions you want to go ahead and address? And if not, I will ask them.
This one I may need some assistance from Jennifer. So they have long-term employees that have 3 weeks sick time, and they weren't required to implement the HFWA until this year. So they have 3 weeks time in their bank. How do they handle that now? My thought is that, I guess it depends on what your policy says, and that time needs to roll over. And obviously, if that's 48 hours, then you've met that minimum requirement. But I don't know that you can just erase that. So Jennifer, if you wouldn't mind popping in on that one.
I agree with you, Teresa, in that this question depends on the precise language of the policy to see if that creates any legal obligations on the employer with respect to maintaining that sick leave bank. or making a change going forward. So say, for example, the policy is strictly a sick leave policy and you have a separate PTO or vacation paid leave policy. So assuming it's strictly sick and there is no language in that policy that could be construed to mean that that was accrued vacation time in any way, shape, or form. And again, it completely turns on the language of that precise policy. But assuming that it does not, then sick leave is not something that has to be paid out or that accrues. That is merely a benefit, a fringe benefit of employment. And so if there, and I would encourage having legal counsel review that precise policy language, but if there is a way to construe that language as strictly sick leave that is not accrued, it's not a wage, then you can make changes to that sick leave policy going forward that in effect would change it from a 3-week sick leave policy to a whatever you want to change it to if you want it to mirror the HFWA. But you can only make that reduction of that benefit if the language provides no ability for the argument that this was accrued leave or could be construed even arguably as vacation.
Great, thank you, Jennifer. It looks like we have a couple more questions on the HFWA and PHE, and I know that gets really confusing. So, if an employee has available HFWA paid sick leave and they get sick with COVID and need to use the PHE, you can supplement available paid sick leave hours toward that PHE. So if a full-time employee needs to take the full 2 weeks off, they have 20 hours of HFWA, then you would pay out 60 hours of PHE, and you can utilize that 20 hours of HFWA to meet that 80 hours. And that would satisfy the public health emergency. So moving forward, they would not have any additional PHE hours available. However, depending on where they were with their HFWA, they could continue accruing HFWA because that's up to 48 hours.
Here's a question that I'm wondering, I may have to do some research on, but maybe Jennifer will know the answer. They have exempt employees and they offer them flexible time off, which includes vacation and sick time. That currently that is not paid out upon termination as the way the policy reads. I'm assuming flex time is going to, I'm assuming flex time is going to fit into that definition of vacation pay. Especially if they have in the policy, what I've seen the DOL do when there's been complaints. For instance, if you have anywhere in your policy that says, okay, here's flex time, and that includes to replace vacation or includes vacation, what I've seen the DOL say, well, that negates everything. That means it's vacation.
Yeah, I'd have to see the language of the policy because I'm not sure what they mean by flex time. Are they meaning like just basically at any point in the year you can take off time for whatever personal needs you want and there's no process involved with that? It's just generally we trust you and you just take whatever time you need. I mean, I'm not sure, but
yes,
even in that respect, employers now have record keeping obligations. So suppose you have a flex time policy like that, and somebody is, using that flex time for some HFWA purpose. The employer needs to know that so that they can track it because you have to do record keeping, their record keeping obligations with respect to HFWA leave. So otherwise the employer is going to be stuck with allowing people to take off as much time as they want. And if they ever need to discipline somebody for maybe abusing that policy, and they get into an issue of like, well, now I need to take a HFWA leave, the employer is going to be stuck and they're going to have to provide possibly even more leave, or they're going to be subject to a claim. So in that kind of a situation, while I know flex time and providing employees with generous benefits is always ideal from a morale and a culture perspective, employers just need to be aware that they have record keeping obligations. And in order to prevent a situation of abusing such a generous policy, it's going to be in their best interest to make sure they're tracking any HFWA leave. Otherwise, they may be in a situation where they're not going to be able to take disciplinary action against somebody who then comes forward and says, well, I need to take this for a sick leave purpose.
Great. Well, we're coming up on the end of the webinar. I just want to thank everybody again, especially thank Teresa and Jennifer. This is always a team effort. And as I mentioned earlier, if you feel like anybody could benefit from this webinar, any of your colleagues, please send it out. We're very committed to education. We want to remind everybody to make sure that they have their handbook up to date. The COMPS 38 is supposed to be in your handbook. I'm sure everybody probably realizes that, but it's time to, 37 was in your handbook last year. Every year you're going to have to update it as the COMPS order changes. We're here if you have any kind of special needs. And if you don't mind filling out the survey when you receive the PowerPoint presentation, that would be great. We're always trying to improve. And does Jennifer or Teresa have anything else?
I was just going to offer a reminder to employers. All of these new regulations and infos and guidance and federal state laws, they all are requiring employers to, number one, have records, maintain records regarding all of these time off policies, paid leave policies, et cetera. And they also require employers to educate employees on them by way of posters being posted in the workplace, by way of distributing copies of information. So just be aware that you have record keeping obligations and you have education obligations where you actually have to advise your employees about their rights. And so go to the Department of Labor website for Colorado. You're going to find all the posters that you need to make sure are posted. And then you're also going to be finding all these infos that we've talked about where you can get that guidance and know this is what I have to make sure I advise my employees of their rights. So just be aware that that's there. You don't want to get audited and you want to make sure you're in compliance.
That also brings up, we do have under our home screen partners. We do partner with the Labor Law Center, and you can get a discount with an HRP discount. If you have a challenge finding it on our website, let us know. But they provide a federal state combined poster also, so that's an option. And then Teresa, do you have anything left?
Not that I can think of.
Great. Well, thank you so much, everybody. If you'd, let us know how we did and give us some feedback, we appreciate it. And we'll see you next month. Thanks so much.